this goes to this conversation. How I explain erectile dysfunction is actually the opposite. I say, what do you need to get an erection, right? So you need 5 things to get a good erection. 1, you need good blood flow to your penis. What can compromise good blood flow? Smoking, vaping, blood pressure issues, heart disease, especially heart disease. Now, if you're in the primary care setting, we do know that erectile dysfunction is what we call the canary in the coal mine for heart disease. If you have erectile dysfunction, you're at higher risk for having a heart attack, stroke 10 years down the line. So, if you're interested in someone's heart health, you better be asking them about their erections. 2, you need good nerves. Now, obviously, when we think about nerves and erectile dysfunction, we usually think about surgeries like prostatectomy or radiation for prostate cancer. But one thing that a lot of my patients don't understand is diabetes, right? We talk about diabetes, your hands, your feet sensation, visual issues. But really, the nerves in your penis are much smaller than the nerves everywhere else. So oftentimes, men have issues with erections secondary to diabetes. And that's one way to really help motivate guys to get their sugars under control. And that's what I'm often telling my patients, like, listen, if you want to have better erections or not get worse erections, you better get your sugars under control. Your hemoglobin A1C is 10. And, oftentimes that will get them actually doing it because sometimes, they can't see these other problems that they may have, but that might be one that obviously is going to be bothering them. 3, you need good testosterone levels. That's something that we're going to go further in detail with the testosterone aspect of this talk. And then 4 and 5 are really the ones when I talk to my patients that are, super tentorial. 4, you need to be aroused or you need to enjoy the relationship you're in. And I know that sounds kind of funny, but I can't tell you how many times I ask patients when I go through this, I say, well, are you having any issues with your partner? And a lot of times they can say, listen, we're considering getting separated. I'm not attracted to my partner anymore. This has happened in our relationship. And that can be a really important part. And referring to a sex therapist, relationship therapist, or just a therapist in general can really help. And the last one is you need to be in a good state of mind. To quote Robin Williams, he said, the problem is God gave man a brain and a penis and only enough blood to control one at a time. And he's absolutely correct. So, if you have high stress, anxiety, depression, your cortisol levels are high, which suppresses your testosterone levels, which can suppress your arousal, and you're really not going to get good erections. And also, unfortunately, if you are put on medications like antidepressants, that can unfortunately also compromise your erection and your desire.